A woman has already had 10 children, she's pregnant, and she says, I'm not going to have this child. And in the village where there are no facilities, a woman will pick up a root. For instance, they pick up a cassava stick, which has got white sap, and that sap is very, very poisonous. She inserts it in her vagina, she has an abortion, and inadvertently dies. What have you achieved? 10 orphans down the line. It would be better to help that woman not even be pregnant at all if she had facilities to family planning.
In Zambia, where 1 in 5 adults is infected with HIV, the epidemic has broken families and left 600,000 children without homes. But HIV is only one piece of a much deeper vicious cycle. Women in Zambia and throughout sub-Saharan Africa have little access to contraceptives. And pregnancy after pregnancy means that they have no time to pursue education, to contribute economically, or plan for their children's future. The United States government has been the leading source of reproductive health funding and technical expertise in the developing world. The U.S. Agency for International Development works through indigenous NGOs to strengthen their family planning and HIV/AIDS prevention programs. But at a time when the largest group of young people are reaching their childbearing years, a new U.S. policy threatens this work.
Now you can imagine how difficult it is to go to young people and say, now this wonderful program which we designed for the next 3 years has to stop. They ask you, why is this program stopping? And you can't explain to them.
On his second day in office, President George W. Bush reinstated the Mexico City policy, also known as the Global Gag Rule, a set of restrictions that prohibits overseas NGOs from providing abortion-related services, even counseling or referrals with their own separate funds. In order to receive U.S. family planning funds, organizations must give up their free speech rights by promising not to engage in political advocacy on abortion, even in countries like Zambia, where abortion is legal.
So in one breath, the U.S. is telling my government to promote human rights, good governance. In the other breath, it's saying, can you take away the rights of women to know about all the issues that surround their reproductive health, and one of them will be abortion anyway.
In most of our hospitals in Africa, particularly sub-Saharan Africa, when you go to the gynecological ward, 50 to 60% of the women admitted in those wards have complications of unsafe abortion.
How can the United States expect organizations not to talk about safe, legal abortion when so many women are dying each day from unsafe abortions?
This reminds me of the case of a young girl, just about 18 years old, who got pregnant and attempted to terminate the pregnancy. Unfortunately for her, whoever attempted to assist her had no knowledge between the difference between the anus and the vagina. Because the rectum and the anus was destroyed, we gave her a permanent colostomy. Imagine what a waste for a problem that is entirely preventable. Yet, preventable as it were, America has not made it any better by denying those various organizations, those various governments that have been working to try and improve the women's health.
Ironically, the Global Gag Rule may actually contribute to an increase in abortions by forcing clinic closures and reducing women's access to contraception. The Planned Parenthood Association of Zambia, also known as PPAZ, is the oldest and largest family planning provider in Zambia. The association doesn't even perform abortions, yet their funding was cut simply because they gave women information on how to obtain a safe abortion.
When you are counseling a young person about the dangers of unwanted pregnancies, in fact, you are preventing them from going ahead to obtain illegal abortion.
With programs in 38 districts, PPAZ was able to help women in the most remote areas of Zambia. These family planning clinics are often the only source of health care in hard-to-reach villages and the only resource women have in the fight against HIV/AIDS.
I met this girl, Selena, and spoke to Selena, who has baby boy aged 6. I was like, Selena, why with a baby boy aged 6 would you be involving yourself in sex work? She looked at me and said, how long would it take for somebody to die of AIDS? And I was like, okay, 6 to 10 years. She says, well, if I die in 6 to 10 years, then my son will be 16. And that's fine. You're looking at somebody who has accepted to die. And she says, look, if I don't do that, 40 days without food, I will be dead.
Zambian NGOs are fighting with every resource to beat the cycle that perpetuates HIV/AIDS.
In this booth, there was an attendant in there who provided information to young people as well as distributed condoms to young people. Because of not signing the Global Gag Rule, the association lost this project through the withdrawal of the funding.
Nearly 70% of Zambia's population is under the age of 24. This means that the largest generation of young people ever are reaching their childbearing years. With few reproductive health services, the road ahead will be challenging. Why would the United States try to deny these young people the tools that they need to survive in such a dangerous world?
And in my language, we have a saying which says, where two giant elephants fight is the grass that suffers. It's our children who are going to suffer. In this case, they are the grass.